Welcome to Family Awareness Program. Some people look nice, they look fine, they look kind, but they behave differently. We cannot ignore their presence in our lives. We have to deal with them in a very nice way, but we have to know how to deal with these people who look different than us. Many questions are being asked when we see a trisomy or a Down syndrome child. How we should behave with them, how we should deal with them, how we can be aware of having a trisomy or Down syndrome child. These questions will be answered by obstetrician and gynecologist, Dr. Samir Halabi. Dr. Samir Halabi, you are welcome. Dr. Samir, you have worked in Canada and you have worked in England and in Lebanon, and you have wide information and comprehensive answers and knowledge regarding trisomy children. Would you please give us a general idea about a trisomy child?
Okay. When we say trisomy, this means that we have an extra chromosome. Okay, it can be chromosome 21, it can be chromosome 18, or it can be chromosome 16. These are the most famous ones. Down syndrome is trisomy 21. We have an extra copy of chromosome 21. And the name of this syndrome came from the British doctor who first fully described it in 1866. And his name was John Down. That's why they called it Down syndrome. Mm-hmm. This syndrome is the most common one, because the other trisomies, as we will explain at the end of this interview, that most of them they will not even survive. We call it miscarriage. Okay, miscarriage of the child. Mm-hmm. And probably this is very important as a natural selection, that if the child has some defect in chromosomes, he will be spontaneously as a miscarriage. Okay, but Down syndrome usually survive. Okay, they survive, and they can. We will talk now in details later that they can attend the schools, etc. Down syndrome occurs 1 in every 1,000 births. Okay.
Around the world.
Around the world. And there's around 5.4 million individuals with Down syndrome. The hallmark of this syndrome is that they have always, approximately always, a physical and intellectual disability. Okay? Mm-hmm. And the IQ for a young adult with Down syndrome is around 50, which means it's like a child between 8 and 9 years old. But this is variable, okay? Mm-hmm. This depends on how much is the degree of this intellectual disability for each one. Each one is, have a variable, okay? We cannot say every person with Down syndrome, he is identical, okay? Intellectually. The important thing about Down syndrome, as an obstetrician, I see it always, because we do prenatal screening for it, okay? This is before birth. And we always should do it between the first and second trimester. We will talk later about that. And then we should confirm it by diagnostic test, because even if the results are positive, we should confirm it later. Mm-hmm. To make sure 100% that the parents, the mother have a Down syndrome, and to take the necessary actions that they feel, because mm-hmm. in some states in the United States they allow abortion, others don't allow. So it's for them to take this decision. And as there is no cure for Down syndrome for sure, these patients, they should have full attention in education and in care mm-hmm. from their parents.
Couples, fall in love and they plan to get married. Then they have to do tests, certain tests. So they want to know if the child would be normal or not, or if they can get married, or any certain diseases. What are the tests that a woman must make before thinking of having a child?
Okay. First of all, I think we should give the viewer how does trisomy happen in life. Okay, this is very important because sometimes we face that the mother feels so sad that she brought a child with Down syndrome, and here we should say that she is not to blame because it happens sometimes by chance. This is very important, that the parents are not to blame sometimes. Trisomy, we have the full trisomy. This means that during the development, we will make it simple. We'll not talk medicine, we'll talk simple.
Yes.
That during the development of the egg or the sperm, okay, we should have half the number of chromosomes we have. That is 23, okay, in the sperm and in the egg. That's why when they combine, they become 46, which is the normal, okay?
Yes.
In trisomy, the full trisomy, what happened? We have a problem in the development of the egg and the sperm. So one of these will have 2 copies of the chromosome 21, okay? So if the egg have the 2 copies and then the sperm comes and fertilize the egg, he will introduce the 3rd copy of the chromosome 21.
That's why it's called trisomy.
Trisomy 21. And in this case, it's called full trisomy. Why? Because every cell that will divide after fertilization will be trisomy 21, will have the extra copy of this chromosome 21. The other kind, which is very rare, and it's around 2%, it's called the mosaic form. The mosaic form, what happens, that we have normal cells and we have cells that have trisomy 21. Okay? It's not all of them. We have mosaic. Normal cells and cells with trisomy 21. And this actually happens after fertilization, okay? That's why we have normal cells, we have cells with extra copy. And the last one we have is around 3 to 4%. And this we call the translocation, okay? Or the partial trisomy 21. Here what we have part of the chromosome will go and become part of another chromosome. That means it can go to 13, 14, or 15. For example, this is the most common ones. In this case, what we have 45, not 46, we have 45 chromosomes, but actually we have approximately all the genetic material. Why? Because this one which we miss, which we don't have now as separate, is actually on the top of another chromosome. Okay? And this is we call translocation. Why I'm saying this? Because those parents who have a translocation, they will carry 50% to their children. Okay?
Yes.
If they don't have it, then it's by chance. Okay? It can happen to anyone.
Okay.
But for sure, the risk increase with maternal age.
Yes.
Okay?
There's an important question usually. We hear it in Lebanon that women who are above the age of 35,
Yes.
they are at a high risk.
Yes.
Okay, so while others tell you that it's about the chromosomes, if you are marrying your cousin,
Yes.
you are exposed. Which one is it true? And if they are true, please explain to the audience.
All of these are true.
All of these?
Yes. As the mother age, as the age increase for the mother, the risk also increase.
Why?
Because it depends on the cell division. Okay. As we know that the eggs of the mother, they start division and then they pause. Okay. So they may stay paused for like a lot of years, from her birth till 35. They are in a pause state. Okay. Then they continue, and then they continue after fertilization. It's complicated. But as the mother increases by age, at 45 years, okay, we have approximately 3% of having child Down syndrome. That means 1 in every 30 child, okay? When she's in 20, it's like 0.1%. And this means it's around 1 in 1,600 child. So you see the difference from 1 in 1,600 till 1 in 30.
Okay.
Every 30 child, there's chance.
Okay. Is there a medicine, if a lady wants to have a baby who's like at the age of 37 or 38? Because I know some women who got the children at the age of 42 and they have normal children.
100%. 100%.
Mhm.
This doesn't mean, we are saying that the risk increase. This doesn't mean that they will have it. Okay? The other point I want to also talk about it, when they marry very close relatives, okay? The DNA, while they are separating, the chromosomes, sorry, while they are separating, they are so identical, sometimes they cross, okay? And they change. That's why they are very identical, okay? I'm trying to make it simple because actually this is a very complicated subject.
Yes.
we also have an increased risk if the couple already had one child with Down syndrome.
Mhm.
And this risk actually increased 1%. Okay, we also have an increased risk, as we said, if they are called carrier parents. That's why I talked about the translocation. If this is present in the parents, they are also at higher risk because this will be present in either the egg or the sperm. Okay.
Okay. So the couple got married and they have a baby, and the woman is pregnant, of course.
Here we should do screening.
Yes. What they should do?
Actually, it's very important that you talked about the age, if it's 35. If the woman is 35 and she's pregnant, it is highly recommended she do these screening tests. Okay? But these screening tests should be done for everyone, okay, for every girl, okay? Because there is also a chance that she can get Down syndrome, okay? Even if she's young.
Okay.
Yeah. So the most important screening test we do, actually there are 4, okay? And as I said, they should be done in first trimester and second trimester, okay? Some doctors do them in the second trimester only, which is not good, okay? We should do it in the first and second. In the first trimester, we can do something we call cell-free fetal DNA. And this is a very, it gives us a like 95% chance to detect this Down syndrome, okay? Because why? We are analyzing the DNA, okay, of the child that is in the mother blood, okay? The other thing that we can do in the first trimester is the ultrasound, which is very important, okay? The ultrasound, we look if there is the small or absent nasal bone. We look for the thickness of the neck. We call it knuckle thickness. We look if the ventricles are enlarged. We look for the right there's an artery.
Yes.
We look at it. There's an abnormality in it. Okay.
So you see like deformity in the
Yes,
arteries
in
and
the
the
ultrasound.
knuckles,
Yes,
the
yes,
back
yes.
knuckles.
And we do some blood tests that include the HCG, and another one is called the pregnancy-associated plasma protein A. So these tests usually are done in the first trimester. The second trimester, we go into much more advanced test. We call the quad screen test, and we go for the integrated test, okay?
Yes.
This, the quad test is from its name, it's 4, very important. The maternal coelom alpha fetal protein, the unconjugated estriol, the HCG, and the inhibin A, okay? So these also, from the results, if they are increased or decreased, we can know if there is a probability of having Down syndrome. What I want to make it clear, that if these screening tests are positive, we should go for a confirmation test. Okay? The confirmation test is done by 2 ways. Something we call amniocentesis or chorionic villus sampling. These 2 tests, what we do, we look at the chromosomes of the fetus, okay? And then we make sure that they have the extra copy of this chromosome 21, okay? But we should also, I want to tell the parents that, for example, if they want to make the test early, so that they make the decision whether to go for abortion or not. The CVS is usually done after 10 weeks of gestation. You cannot do it before because there is a risk of miscarriage or some like defects will happen, especially to the limbs of the child.
Wow.
So it should be after 10 weeks. The amniocentesis is after 15 weeks. Okay?
Very interesting.
But as we do it later, this means that there are risks for the abortion, you understand?
Yes.
So they should decide very early what they want to do.
You know, now the child has come to life.
Yes.
So what are the things you like to advise the parents first, how to deal with that baby, you know, because the parents' love will not differ if the baby is with Down syndrome or a normal baby. The love is the same for both. Maybe they should take care more of this child.
As we said, I will give you some figures. In the States, around 92% of the parents choose abortion. They choose it, okay? In Europe, it's around 75%, okay? So once we diagnose this one, the parents take, and here we should talk with them, okay? We should inform them about how the child, okay, when the child comes to life, okay? These children will have physical, as I said, and intellectual disabilities. They will have poor immune system function, okay?
Oh, wow, interesting.
Yes.
So what they should avoid if they have,
when you have
poor immunity?
Poor immunity, this
like
means
cuts
you can have infection more easily than others, etc. They can develop epilepsy, leukemia, thyroid disease.
Wow.
Yeah, they can develop heart problems. And here I will tell you some of the things that are in Down syndrome by the percentage. When we talk about mental impairment, it's 99% present. 99%. Stunted growth. This means that their developmental milestone, okay? You know that the pediatrician, when you take your child to a pediatrician, he will examine his developmental milestones. His smile, how he touches things, how he plays, how he moves, how he raises his neck. So these are fixed for normal people. In these people with Down syndrome, they are delayed, okay? The growth is stunted. There is an increase in skin on the back of the neck. There is low muscle tone. There is a flat head, as we see. Flexible ligaments.
What do you mean by flat head? They don't have the frontal lobe?
No, it's more flattened. If you take a profile of
there's
the
this
face.
Deformation.
Yes, for sure. And
okay.
we have here the epicanthal folds of the eyes. They also have this one. They have abnormal teeth. They have large and protruded tongue, if you can see.
Why?
This is
deformity with the chromosome.
This is. They have a single transverse. We call it Palmer, okay, grease. They have brush field spots in the iris. They are prone to obstructive sleep apnea. As you can see, they have also short neck. Okay, the neck is a little bit short. They have a congenital heart disease. Okay, all of these things.
So you mean they are exposed more than other to cardiovascular diseases, or just they are born with the deformity in the cardio?
They actually are born with it. We call it congenital.
Congenital. Cardiovascular issue.
Heart disease, not cardiovascular.
Not
heart
cardiovascular.
Disease. Heart disease. There is defects in the heart. Okay. There's separation of first and second toe in 68%. As we said, flattened nose, strabismus. The testicles sometimes, but it's 20%. It is undescended. So this they have to face it, okay? And this child needs a lot of attention, okay, and care.
Yes, you know, you said that they are born with different facial feature, different appearance, you know, with these deformities. So, regarding education, can these children go to a normal school?
The most indicator for this thing, as I said, is the intellectual disability. Okay,
Mhm.
we know 100% cases, and I've seen them in England, Canada, etc., that we have many children who went and even graduated to high school. Some even went to universities. We have cases that they work and they get paid, okay? And we also have cases which they need specialized education and schools because they have auditory problem, they have visual problem, they need a lot of attention, and the school should be prepared for that, okay? So this is depend on the child itself.
Okay, so you think there's a better way dealing with the Down syndrome patients or children. I don't want to call them patients because I feel that like they have their own world and we have our own world. So
Yes.
we have to accept them and they have to accept us. Like for instance, in Lebanon, they opened the restaurant and all the waiters and waitresses are with Down syndrome and they offer food to people. So their parents have been working on them for a long time and guiding them to reach this. So what about schools in Lebanon? Do we have special schools in Lebanon for trisomy children?
Yes, I know that there are some specialized schools which offer a lot of help to these children. As I said, these children spend most of the time with the school nurse because of repeated, they have a lot of symptoms, they have a lot of problems that they go there. The school should be also have some like speech therapy, occupational therapy. They should undergo all this process. In Lebanon, yes, there are, but unfortunately, as you know, very few.
It's incurable.
Yes, very.
Okay.
And it's not curable for sure. Yeah.
It's incurable. What would you like to say to the people who have like a trisomy neighbor or the parents who have a trisomy child at the end of this episode?
I think we always tell them that this is a gift from God, and I know that the parents, I've seen fathers who love their children because it's his child.
Yes.
Okay, and unfortunately there is very few who actually are like either they are willing to give the child away or they are sometimes going more into like abusing them and hitting them. Okay.
Wow.
So I prefer, as we said, that this is a commitment, and in 2020, these children, if we take care of them, they are able to live 50 to 60 years. Okay. So this is a long commitment with these children. So they have to decide before they bring the child to life if they want to give him the full care or they have the capacity to give it or not, and take the appropriate action for them and for their child. Okay.
Yes, Dr. Samir Halabi, obstetrician and gynecologist, thank you so much for the precious information that you have given to the parents, to the viewers. I want to thank you, and one last thing I would like to say, that we are all born with issues, physical problems or mental problems or health problems or any problems we would encounter. But we have one hope that is in God. So we have to depend on God in everything, whether we have a Down syndrome child, Down syndrome friend, or just a regular friend. We have to depend on God in everything. Thank you.